Assalamu alaikum.
Salam alaikum.
Hello and assalamu alaikum.
My name is Erica Ting. I'm one of the MedPeds residents at the University of Minnesota, working at CUHCC Clinic and next year at Hennepin Clinic.
My name is Arthi Bhatt. I am one of the internal medicine and pediatrics doctors at the Community University Healthcare Center, also known as the CUHCC Clinic.
Last year, 2020 was an incredibly hard year for many of us in our community. Unfortunately, preventive clinic appointments such as well-child checkups were often missed as more urgent family needs arose and concern over catching COVID-19 from clinics grew in the community. As well-child checkups should occur on a yearly basis for most children and more frequently for newborns. This means that our community's children are behind on health screenings, vaccines, developmental assessment, and management or prevention of illnesses.
Here and now in 2021, our clinics in the community are open and ready for our pediatric patients and their families to come back to see us. Now is the time to catch up on medication refills, health checkups, and vaccines.
When you're thinking about scheduling an appointment for your child, a few questions may arise. Is it safe to go back to the clinic? What will the waiting room look like?
What will the doctors and the staff be wearing? What should I wear or my children?
Will children who are sick be in the same space as children who are well?
We are hoping you spend the next couple of minutes with us as we walk through what to expect at the clinic in 2021. Thank you for your time.
I'll be talking to you about what to expect with your child's clinic visit. You can contact the clinic to make an appointment. When you call to make your clinic appointment, ask what kind of safety measures the clinic is taking to reduce spread of COVID-19. Typically, you should show up with your children a few minutes earlier than your appointment time to get checked in and screened for any exposures to COVID-19 or current symptoms. You will be asked if you spend time around someone with known COVID-19 and if you are having any symptoms like fever, chills, shakes, cough, or sore throat. This will help the clinic workers know what kind of protection they might need: mask, gown, gloves, to keep everyone safe. You should wear a mask anytime you are out in public and will also be asked to wear one in the clinic building, including the waiting room, during the visit with the provider. If you or your child have no symptoms or concerns for exposure to COVID-19, you will wait in the waiting room for people with no symptoms, with sitting areas spaced 6 feet from other parties, without common play areas, and with access to hand sanitizer. If you are having symptoms of possible COVID-19 or have known exposure, you will be asked to wait in a separate area. Here you will have safely spaced 6 feet apart seating areas and access to hand sanitizer. When your appointment time arises, a nursing staff will bring you and your child to check height, weight, blood pressure, and other vital signs before you get settled in a patient room to wait for the provider. These are all the same things you usually do for a clinic visit. They may just happen in a different room or area than you're used to, as clinics have taken steps to ensure infection safety. Nursing staff cleans the tools needed to perform these in between each patient visit. Your provider will then come in wearing a mask that covers their nose and mouth and an eye covering such as a face shield. This protects them and you from any potential exposures. Often this can be hard for children as they cannot see the kind face behind the mask and face shield. People find it helpful to demonstrate this and explain to children before they go back to the clinic. If you are having symptoms or have a known exposure, the clinic staff will wear a gown and gloves in addition to the mask and the face shield. This, again, is to keep both of you, the staff, and others in the clinic safe.
We'll complete the visit, perform any needed vaccines to catch up or labs, and plan follow-up, just like a typical visit. After you and your family leaves, the surfaces of the patient room are cleaned to make the space safe for the next family.
Hi, my name is Dr. Sahar Ahmed. I'm a pediatrician in the Twin Cities. Regular checkups are very important for children's healthy development. At these visits, we screen for any developmental, social, or medical concerns, do a complete physical examination, including hearing and vision testing, and catch children up with recommended vaccines. These visits are therefore a chance to detect disorders, diseases, and problems early so we can change our children's lives for the better. Vaccines are a key part of this. Vaccines or immunizations are given to infants, children, adolescents, adults, and our elderly families across a large population to protect everyone from sickness and death. Your child's vaccines protect them from infections that cause severe breathing trouble, seizures, illnesses with high fever, and other high-risk medical conditions. When you vaccinate your child, you prevent the spread of disease, protecting those too young to get vaccinated or too old to fight off disease. Our newborns and elderly, both from the same disease complications and death. It's not too late to come in to catch up on missed vaccines. Your clinic and provider will know which vaccines to give to keep your child and family safe in the upcoming years. Please come with your questions. We are eager to have these conversations with you and your family.
COVID-19 will be here in our community for the upcoming years. However, we as a community are healing. Currently, the best thing you can do to protect your children is to get vaccinated against COVID-19. Ask your doctor more about this and ask your clinic when and where you can receive the COVID vaccine for yourself. Already, children 12 years and older are able to receive the COVID vaccine that's made by Pfizer, and we expect more vaccines to be available for younger children before the end of 2021.
Thank you for your time today, and we look forward to seeing you in clinic. Call your clinic today to get an appointment.
Thank you for your time. We'll see you soon at CUHCC.